Hey everybody, it's Stephen again, first year PA student, and I'm just doing this video for my second episode of Life as a PA. Obviously not a PA yet, but PAS1, and enjoying myself, still in my first year of PA school. So in my last video I talked about how I was in my women's health section for my medicine class, and we had the exam, and I did very well. I passed, which my school is pass-fail, which I'm very thankful for. So I passed. I'm on to the next section with this, which is psychiatry, which has so far been very interesting. I worked with a lot of psych patients when I worked at the hospital. I was a float CNA, and they would often put me one-on-one with patients who were Baker acted, which is a Florida term, so it just means someone who's in the hospital for 72 hours because we want to do a thorough mental health workup on them or worried about their safety or others' safety. I was often the person that they would put one-on-one to watch over the patient, take care of them, and make sure that they had someone with them at all times for those 72 hours. And so I had a lot of experience with patients with different psychiatric disorders, whether that was schizophrenia, bipolar disorder, the major depressive, severe anxiety disorders, stuff like that. So this section is very interesting to me. One thing about psych that is tough is that you have to experience it firsthand. You can learn all about the different illnesses and medications and stuff, but until you actually get to be in the room with a psych patient, you don't really know what it's going to be like. So I'm excited. We have a patient coming to our class tomorrow, actually, and I'm really excited to listen to their story and to talk to them. What else happened this week? So another thing that happened this week was I learned how to tie knots, surgical knots. We had our knot tying lab. Next week is our suturing lab. And so for all the PAs out there that want to go into surgery, this is kind of when we start learning how to do that in our clinical procedures class. We learned two knots. We learned a one-handed and two-handed tie for the square knots, which is called like the surgeon's knot. And there's no slip knots that you would tie maybe to tie off a blood vessel before cutting through it, or tying off something else in the body. And it was interesting at first, very overwhelming, but once you get it down and you just start flowing with it and you get the muscle memory there, it actually is pretty easy. It's not too difficult. The next step, of course, is being able to do it under pressure and to make it nice, look nice, and to make sure that it functions and actually does its job. Because right now I have my knot board here for you to see. Right now we're just kind of doing it on these little rubber things, and that's obviously not what a blood vessel is going to be like in the body, and we're using shoelaces, which is obviously not suture material, so I'm going to have to practice that as well, but I'm excited for that. Another thing that happened this week, if you remember my last video, I talked about getting signed up for my COVID vaccine, and I got the first dose, so it was awesome. It was really easy. I went to Walmart pharmacy, and they had me in and out. My arm was a little sore the next day, just like when you get like a tetanus shot or a flu shot. Sometimes your arm gets sore the next couple days, like you worked out really hard. But so far, that's it. And I get my second dose in the middle of March, which I'm excited about. I think I'm going to make a video about my vaccine experience. There's a lot of people out there who I think have information that is not correct, and just some things that I think I can help clear up with my research and what we've been taught in PA school, and the evidence-based research that we've had. So I'm excited about that opportunity. It's a very controversial subject, I know, but I think this is a really cool thing. Science, thankfully, has helped us out with a lot of really bad diseases, and hopefully COVID will be the next one on the list that we don't have to worry about anymore because of vaccinations. What else is going on? Not too much. Last week I talked about Valentine's Day and how important it is to spend time with your loved ones. This week I use an app called Headspace for mindfulness practice. It's really awesome. I'll post the link down below. And this week I've been doing a balance course of meditation, and that's been super interesting and beneficial, and I think it ties into that whole idea of balance while you're in PA school or in a stressful time in your life. You got to make sure that you're staying physically fit, mentally fit, mental health wise. You got to do well in school, but you also got to spend time with your loved ones and take some time for yourself finally. So just something to think about if you're in a stressful time, or if you're in PA school, or if you're going to PA school. Like I said in my last video, while you're a PA is not the time to perfect your work-life balance, this is when you start building it. It's while you're in PA school. So anyway, I'm Stephen, PA student, and if you like this video and you want to hear what's going on in my PA school career, go ahead and like the video and then subscribe as well. That would mean a lot to me. And until next time.